I'm pretty sure you've heard of this word somewhere before. After all, it has been declared as a top 10 leading cause of death according to the World Health Organization. About 422 million people worldwide have diabetes, causing 1.5 million deaths yearly. While doctors emphasize basics like a good diet and exercise, recent studies reveal some interesting habits that can notably cut diabetes risk. This video explores these alternative strategies to decrease the risk of diabetes, explaining how they help and offering cautionary advice. Remember to be careful when trying these unconventional methods. They're extra considerations, not substitutes, in the overall effort to reduce diabetes risk alongside the proven healthy habits and expert medical advice. But first, what is diabetes? It's a long-lasting health condition that affects how the body handles blood sugar, possibly causing issues with the heart, kidneys, blood vessels, and other tissues. Lowering the risk of diabetes naturally involves simple lifestyle changes. Eat a balanced diet with lots of real food like fruits, veggies, lean proteins, and whole grains, while cutting back on processed and sugary stuff. Stay active with things like brisk walks or cycling to manage weight and improve how your body handles insulin. Keep a healthy weight, drink enough water, and get good sleep. Watch alcohol, quit smoking if you do, and look after your overall well-being. These steps really help cut diabetes risk, but there are also some unconventional methods of lowering the risk of diabetes. So, what exactly are they? Feeling stressed at work all the time? Maybe it's worth changing how you deal with stress. Managing stress well is important in lowering the risk of diabetes by dealing with key physiological factors. Chronic stress triggers the release of hormones like cortisol, contributing to insulin resistance. Stress management techniques, including mindfulness and relaxation, enhance insulin sensitivity, promoting balanced blood sugar levels crucial for diabetes prevention. Also, stress management helps curb inflammation linked to insulin resistance, fostering an overall environment conducive to metabolic well-being. Moreover, adopting stress-reducing practices often correlates with healthier lifestyle choices, such as a balanced diet and regular exercise, further mitigating diabetes risk. Prioritizing stress reduction becomes integral in a holistic approach to lowering the risk of diabetes. Here's a surprising fact. Diabetes rates, both type 1 and type 2, tend to increase in places with higher temperatures. Even a 1 degree Celsius rise in outdoor temperature could be linked to over 100,000 new diabetes cases annually in the USA. On the flip side, exposing yourself to the cold, like taking cold showers or being in colder environments, could impact diabetes risk by activating brown fat. This type of fat burns calories to produce heat, potentially helping with weight management, a crucial aspect of preventing diabetes. Cold exposure also seems to improve insulin sensitivity, making cells respond better to insulin, and it might enhance glucose metabolism, reducing the risk of insulin resistance. While more research is needed, these effects suggest that including controlled cold exposure could be part of a comprehensive approach to lowering diabetes risk. If you enjoy spices, consider adding more to your meals. Herbs like cinnamon, turmeric, and fenugreek might contribute to lowering diabetes risk by improving insulin sensitivity, regulating blood sugar, and displaying anti-inflammatory properties. Cinnamon, for instance, has demonstrated potential in enhancing insulin function, and fenugreek may slow down sugar absorption. These herbs also contain antioxidants that combat oxidative stress associated with diabetes risk. While these findings are promising, it's important to incorporate them into a balanced diet and consult healthcare professionals for personalized guidance. Thinking about trying intermittent fasting to lose weight? Intermittent fasting involves alternating cycles of eating and going without food. Some observed benefits include making your body more sensitive to insulin and helping with weight control by cutting down on calories. It also supports better blood sugar regulation and prevents insulin resistance. It could also boost metabolism, improving efficiency in how your body uses energy. Fasting periods might even help reduce inflammation linked to diabetes risk. Just remember that intermittent fasting is not for all. Our bodies react differently, so it's crucial to check with healthcare professionals before trying intermittent fasting, especially if you have existing health issues. Diabetes prevention extends beyond traditional methods. Embracing stress management, controlled cold exposure, spices, and intermittent fasting offers a nuanced approach. These unconventional strategies supplement established practices, contributing to a holistic defense against diabetes. You know what can reduce the risk of diabetes? Limiting the number of calories you take in. Calorie counting is a simple weight loss method in which you monitor and control calorie intake from food and beverages. However, this method is met with skepticism by certain nutritionists and dietitians who question its effect on overall health. Check out this video to learn more about calorie counting.